Just to let you know, we're going to review some key components of our International Student Benefits Plan. There will be opportunity to ask us questions at the end, but we can also follow the chat bar if you've got any questions as we move along. What we'll cover today is international insurance. Do you need insurance as an international student? What does coverage look like? So what does it cost? What is the emergency health insurance plan? What is the health and dental plan? When does coverage begin? Can you add your family to your student insurance? How you can use your insurance. And we'll talk a little bit about the Nova Scotia Health Card, or MSI, and what does that mean and impact it has for our international students. Where can you go to get treatment, and where you can find more information on your plans. So first and foremost, do you need insurance? You do. As an international student, as well as our domestic students, everyone has insurance at NSCC. It is a requirement upon enrollment with the college. It provides support for students to maintain good health while completing their studies. Given the amount of investment that international students make in coming to Canada and coming to NSCC, we really think it's important that coverage is provided to students. And it has provision of coverage in the event that you become ill or injured in Canada. We want to make sure that all of our students are properly supported. What does it cost? I'm going to hand it over to Mary Catherine, who's going to walk you through the cost involved with our international coverage.
Hi guys, Mary Catherine here. So for students arriving in Nova Scotia who do not have MSI coverage or the Nova Scotia Health Card, your fee for 12 months of coverage is $881, and that is paid directly to the college when you make your tuition and other student fee payments. The cost is broken down such as this. Emergency health insurance, so this would be what would be considered your MSI comparable. That is $639. And then your health and dental benefits, and this would be for your supplementary health insurance, and that is $242. Now for students who are arriving in Nova Scotia and are immediately eligible for MSI, or are a second year returning student who has become eligible, your fee is $292. And this is broken down for emergency health insurance, which is $50, and health and dental benefits, which is $242.
And we'll talk about MSI and those other parts momentarily. But we're going to talk first about the emergency health insurance plan. So again, we talked about this being mandatory coverage in order to attend NSCC. And it is typically used when seeking emergency medical attention of a healthcare professional or service. So that means a hospital visit, meeting with a clinic physician because of an emergency medical situation. And as Mary Catherine stated, that is provincial healthcare comparable. So it covers things like a hospital stay. So if something happened and you required an operation or to be hospitalized, that's the type of coverage that would carry you through that.
Absolutely. And it would also cover you in the instance where you need to go visit a walk-in clinic to see like a family practitioner. You would be able to use your emergency insurance to go receive service from one of those physicians as well, if the situation you are in is not a severe emergency. Walk-in clinic is a great option as well.
So that's the type of coverage that is covered under your emergency health insurance plan. People will ask why that's so expensive. Because we are subsidized as citizens of Nova Scotia with our MSI, the coverage is a bit more expensive because it is covering high cost access or high cost coverage items. So hospitalization. What else would be covered there?
Any type
dental emergency.
Dental emergency. Any type of treatment that's required after a diagnosis from an emergency situation would be covered through the plan as well. So if you were in an accident and you required physiotherapy in order to fully recover, the physiotherapy would be covered through your emergency insurance because it's resulting from an accident that you required emergency care for.
So that is generally what's covered through your emergency health. And we talked a little bit about MSI. So the Nova Scotia Health Card, that is our provincial health coverage, as we talked about. So it provides benefits that are comparable to that $639 plan we mentioned moments ago. Two things we want to share with our international students. If you are coming to NSCC with a study permit, you are eligible to apply after 13 months of residing in Nova Scotia. So if you're coming as a first-year student and you remain in Nova Scotia and maintain your residency, you have the ability to apply for that MSI card. If you have a work permit, you're eligible to apply for MSI immediately upon arrival in Nova Scotia. And so if you get your MSI either after the 13-month residency requirement or as part of a work permit, you can use that MSI coverage to opt out of the emergency health insurance plan. So if you remember back, we talked about it moving from $881 to $292 if you have MSI. Because with your being eligible for MSI, you then have the benefits that are required to cover emergency medical attention, those types of things that we are able to opt out of that portion.
One thing I would just like to point out regarding the work permit, if you are arriving in Nova Scotia with a spouse or a partner who is here on a work permit, even though you are here on a study permit, you may be eligible to receive the MSI card based on your partner's work permit. So that's definitely something to look into as well, if that's the situation that you are in when arriving here.
Now, the Nova Scotia Community College is not able to opt you into MSI. That must be done directly with the Nova Scotia government. However, we have details about how to apply for MSI that will be on the Student Benefits website. But you can also, there are links provided in your student handbook that you'll get in September. So lots of opportunity to explore that. And we're happy to support you with any questions that you might have. So we talked a little bit about it, but I'll let Mary Catherine go over it. This, in terms of what does that emergency insurance cover?
So the first one to point out is doctor's appointments. So you are entitled to have one checkup permitted each year with a family physician, either at a private practice or a walk-in clinic. After that point, you are eligible to claim expenses or have expenses sent off to the insurer for doctor's visits when they are in conjunction with an emergency situation. And confirm, an emergency situation does not mean a drastic emergency. It's something that's going to affect your day-to-day living while you are studying at the college. So that could mean you have a throat infection, you could have an eye infection, anything like that means that you are able to go visit a doctor and get checked on. Those are considered emergencies as well. It also covers you for hospital visits or stays. We did go over this a bit earlier, but just a reminder, that would mean if you had to go to an emergency room to get checked out, or if you were admitted into the hospital and were receiving prolonged treatment, it would be covered through your international emergency insurance as well. You also have coverage for emergency care of a pre-existing condition. So what that means is if you require medical attention based on a pre-existing condition that you've previously been diagnosed with, you will receive coverage for that. What that also means is that if you do have a pre-existing condition, if your coverage won't cover you for basic treatment of that condition. So for an example, if you have asthma, this plan, the emergency insurance, wouldn't cover you to have refills of your puffer or other medication. But if you find yourself in an emergency situation, such as you are having an asthma attack, then you would certainly be able to go see a doctor or go to the hospital and have that visit and any subsequent treatment covered based on the emergency that you are experiencing with this pre-existing condition. As well, prescription drugs that are prescribed to you due to an emergency situation are covered as well. So these are just some of the coverages under your plan. There are many more, and those details will be provided to you upon enrollment in the emergency health insurance plan.
So that information will go out to students in the month of September to provide them with some details. And then we'll talk more about how to utilize your plan momentarily. Oh, okay. So in terms of the health and dental plan, this is supplementary insurance coverage that's used in combination with your international emergency coverage or with MSI should you meet the requirements of that program. It provides preventative coverage. So it is used to kind of maintain your level of health. So this would be things like going to the eye doctor and having your vision checked and potentially getting glasses or contact lenses. Dental cleanings, which we do every 9 months, 9 to 12 months, regularly to keep good oral hygiene. Chiropractor visits and other types of paramedicals that aren't necessarily as a result of an accident, but are good to kind of keep a preventative type of coverage.
Yeah, absolutely. So basically what this plan does for you is supplementary to your emergency plan. So it's more elective. You can go see a chiropractor if you have neck pain or back pain already, but it's not being diagnosed as anything. You have the ability to use this health and dental plan to go visit that type of practitioner to get treatment to prevent an injury. So whereas your emergency insurance is being used when you are in a medical situation where you require immediate attention by a healthcare professional, the health and dental plan is an insurance that you can use in order to prevent getting to that situation. So you don't require, for some of the coverages through this plan, you do not require visiting a doctor before going to access some of these services. And we can certainly go into more detail about this. It will be broken down on the website, which we will provide the information to you in a little bit, as well as you can always reach out to myself in the benefits plan office to kind of go over what type of situations you would use these different insurances for. And again, these are some of the coverages that your health and dental plan has. So again, prescription drugs, you have eye exams can be covered, as well as eyeglasses and or contact lenses. Paramedical providers, so those are practitioners such as registered massage therapists, osteopaths, naturopaths, and social workers and psychologists. Medical equipment and supplies, so should you require the use of crutches, or if you temporarily need like a wheelchair, those types of rentals would be covered through your health and dental plan, as well as dental care. You can, as Lori had mentioned, go visit a dentist to get an annual cleaning, as well as receive some minor restorative treatments such as fillings and oral surgery and extractions if you require those treatments as well. And new to this year is travel insurance. And this is a really important one to note because for international students who are opting out of the emergency health insurance plan based on receiving their MSI coverage. If you are a student who is here on a study permit, then your MSI card will not be valid to be used outside of the province of Nova Scotia. So having this travel insurance through the health and dental plan enables you to leave the province and visit other areas of Canada while still having access to emergency coverage if you get into an accident or require medical attention while traveling outside of Nova Scotia. And again, just to note that this coverage can be used without the situation and being in an emergency. So different from the emergency health insurance plan, the health and dental plan is completely supplementary and is used as more of preventative care compared to the emergency health insurance plan. So your coverage will begin for both of these plans on September 1st. So again, it's important to note if you are arriving before September 1st, you may want to look into getting your own private coverage until that date in case something were to happen while you were waiting for this coverage to begin. Both of these plans run for 12 months. So that means that you will have coverage if you are beginning your program in September and your coverage begins September 1st, you are going to have coverage up until August 31st of 2019. Again, if you are returning to the college that September and still meet the eligibility requirements, you will automatically be re-enrolled for a secondary year. If you are not returning if you are not returning, then you will lose that coverage as of August 31st, 2019. Two things to note is the emergency health insurance. That begins September 1st. And there is no waiting period to start accessing those benefits should you need to. That means that once September 1st hits, you will receive an email from the insurance company with your plan details and your PayDirect card. So if you require the attention of a doctor, as of September 1st, you will be able to go in and see a healthcare provider and give them your insurance information. For the health and dental plan, there is a 45-day claims waiting period, and what that means is that although the plan has a start date of September 1st, the first 45 days is a validation period, and that's just so we can collect the information of the students who will be enrolled on the plan, and then they are enrolled in the middle of October, but the plan is backdated to September 1st. So if you require the use of the health and dental plan within the first 45 days of your program, you will have to pay for those services up front, but then you can submit the receipt for reimbursement once the 45 days are up. After that point, you will be able to use your My Benefits card, and we will explain where you can get that, to have eligible expenses direct billed to the insurance company. And for those of you who may not know, direct billing is when the healthcare professional or provider sends the claimable expenses directly to the insurance company. So that means the insurance company will be sending the reimbursement to the provider, and you are only responsible to pay the difference of the expenses. So can you add family to your insurance? You absolutely can. If you are coming to Nova Scotia with a spouse or partner and or children, they can be added to either your emergency health insurance plan or both the emergency health insurance and health and dental plan. Keep in mind, in order to enroll your family onto the health and dental plan, you will be required to have them enrolled in the emergency health insurance plan first. And so if you look to the right of the screen, you'll see the breakdown of the fees. So for the emergency health insurance plan, to add one dependent to that plan, whether it's a spouse, partner, or child, the fee is $565.75. To add two or more dependents to the plan, the fee is $850.45. And that's on top of what your fee is, which would be the $881 fee that we discussed earlier. To add them to your health and dental plan, Adding one dependent to health is $150, and adding 2 or more dependents to health is $220. Adding one dependent to dental is $200, and adding 2 or more dependents to dental is $280. Now, it's important to note you aren't required to add your family to this insurance. It's not mandatory. And if you are adding them to the emergency health insurance portion, you are not required to add them to the health and dental plan. So you can certainly review these fees, and you can review the coverage as well and decide what is best for you if you are arriving here with family. If you are deciding to add them to one or both portions of the plan, you can submit the online family add-on form, which will be available on our My Student Plan website as of this Wednesday. And the fees will be listed on that website as well. And so once the once you submit the family add-on form, it'll be reviewed by my office, and we'll contact you to confirm the amount. And that fee is paid directly to my office, unlike how your fee is paid directly within your tuition and student fee payment directly to the college. So if you do have any questions or just want to talk about your options, please feel free to contact my office. You do have until the end of September to add your family to your plan. So using your insurance, you will have 2 different benefits cards if you are remaining enrolled on the emergency health insurance plan. As of September 1st, you will be emailed your insurance details for the emergency health insurance plan, and that will consist of your PayDirect card. This insurance is provided by the insurance company Lloyd's of London. And again, this is the card that you would use in an emergency situation where you're visiting a doctor or the hospital. And the second card you will have is the Health and Dental My Benefits card, which you can self-create on the website, mystudentplan.ca. And this insurance is through the company Great West Life. It's really important that you keep both of these cards with you at all times, because if you are in an emergency situation and require immediate medical assistance, you will have your insurance details for the hospital or clinic to send any covered charges directly to the insurance company. But the cards also have the contact details for the insurance providers if you need to get in touch with a representative from either Lloyd's of London or Great West Life. So when you arrive to a clinic or the hospital, you'll have to present your card to them in order for the direct bill charges to be sent off to the insurance company. If you do not have your card on you, you may have to pay for the services up front, but you will be able to submit those receipts as a claim to be personally reimbursed. If you do have any questions about which card you should be using for a certain type of situation, you can either call the benefits plan office and we can go through the situation with you, or you can contact the insurers directly. And again, their contact details will be available on both of your cards as well as on our website, mystudentplan.ca.
So that, a bit of key information there is to make sure that you're carrying these benefits cards with you. It is always in your best interest to have these in your wallet, on your person, because you never know when you're going to be required to present that information in support of any health care that you receive.
So where can you go to get treatment? In reference to the emergency health insurance plan, walk-in clinics are going to be probably your best option for getting medical attention. They have much shorter wait times. Currently in Nova Scotia, there is some wait times to see doctors, and we are in the process of acquiring more family doctors in the province. So visiting a walk-in clinic will be a great option if you do need to get attention for an illness or an injury. For more serious emergencies, hospitals would be your best bet to go to. You can go into the emergency rooms and be triaged and then receive the medical attention that you require. You can also talk to a pharmacist and they work at the pharmacies here in the province. Those would be pharmacies like Guardian, Costco, Lawtons, and Shoppers, and they can assist you with triaging what your illness or injury could be and provide you with some remedies for that as well. And that's where you can also go and get your prescriptions refilled and get info on over-the-counter medicine for cold and flu. We made a note here, be a smart shopper. So pharmacies such as The Guardian and Costco and other smaller businesses, they offer cheaper prices on medicine. So that's a great way to save a few dollars when you are requiring prescriptions. Again, direct billing options will be available. We are working with local clinics and the hospitals to set up the information for the International Emergency Health Insurance in order for students to be able to have their expenses sent directly to the insurance company. And most pharmacies and paramedical providers, eye clinics and dental clinics are already set up to direct bill to Great West Life. If you are in doubt with what type of medical situation you are experiencing, you can call the 811 helpline. So that's to speak with a registered nurse to go over what it is that you are experiencing, what your symptoms are, and they can direct you to the proper medical attention that you should receive. And this is also available in 125 languages. So you can always talk to one of the registered nurses on this line to go over your symptoms and find out where you should be going in order to get checked out. So where else can you find information on your plans? As of this Wednesday, August 1st, all the international details will be up on the website mystudentplan.ca. Once you get to the website, you'll see her on the right-hand screen. This is exactly what the web page looks like. You'll choose your school, which is Nova Scotia Community College. And this website offers as an information resource hub for everything on the International Emergency Health Insurance Plan, as well as the Health and Dental Plan. It provides you with coverage details, the opt-out and family forms, as well as claims information. You can also visit our office at the IT campus up by Student Services. We are open Monday to Friday, 9 a.m. to 4 p.m. You can call our office at 902-491-1624. We also offer a toll-free line, so if you are attending NSCC but not within HRM in the Halifax metro area, you can call toll-free at 1-866-491-1624, as well as email us at nsccplan@mystudentplan.ca.
So at this point in time, if there are any questions, we can review. But just to let you know that we will be posting this on our website, so it will be eventually uploaded to My Student Plan, and it will also be in our Get Started SharePoint site. So we will be providing that link out in multiple formats, and then anyone can follow up on any questions that they still have based on the recording.
Absolutely.
All right, well, thank you for joining us today. We hope that answered some questions that you had about the International Benefits Plan, and we look forward to serving you in September.
Wonderful. Thank you, guys.